For the third time in a row, UTMB has been named among the top 10 hospitals, academic health science centers in the United States for its best care practice programs. That award is bestowed by Vizient Health Systems yearly on those institutions that meet the criteria of putting themselves on the line for healthcare quality and efficiency, safety of the patient, patient satisfaction, and numerous other criteria. UTMB ranked number 9 in that top 10, and that's nothing short of miraculous work by the people at UTMB and all of our healthcare, nursing, medical, other staff members. If you remember a few years ago, UTMB was down at the 74th position and then found its way up into that top 10, migrated up to number 4 in the nation, and this year remained in that top 10, although we did go down a bit to number 9. So that was great reason today to celebrate, throw out some t-shirts to the teams that work at UTMB who made that possible, give a shout out to those in the past who have supported this effort, like Donna Sollenberger, our former CEO of the health system, David Marshall, another former member of the health system as Chief Nursing Officer, and our own Dr. David Callender, the President and CEO of UTMB Health for the past 12 years. We celebrate our staff today for their continued work in this area and their preparation for the future. Once we've made the top 10 3 times in a row, is something we'd like to duplicate every single year. The rest of our discussion today really focused on the areas of excellence here at UTMB and how we're doing as we look to the future. Many of us have particularly been worried since Dr. Callender's departure from UTMB Health was unexpected at best, although he went to a singularly great job with the Memorial Healthcare System as its president and CEO, another award-winning hospital system in the Houston area. Dr. Callender has led us since Hurricane Ike devastated our campus for a period of restoration, expansion, renewal, and growth that has been unprecedented. As we look over our strategic plan, we are committed to continuing that growth as we look here on our own campus for the opening of the Health Education Center, which will occur October of this year. We actually already have it open and students in it. Matter of fact, it's been such a popular spot on our campus that we've already had our Council of Deans recommend an increase in the hours of operation from 12 hours a day to basically 18 hours a day in serving our student body. Remember, all students from the schools of Allied Health Sciences, health professions, School of Nursing, graduate school, and our medical school and PA school are now involved in clinical training over at the Health Education Center that sits just west of Levin Hall on our campus. It's one of those things that once one walks in it, one realizes that it's really truly a magnet for learning as students want to be within those halls to continue their fellowship with each other and their study of the science of medicine. We also have another group of activities that include major expansions going on in the Angleton-Danbury campus over in Brazoria County. 5 years ago, when we undertook the management of that small rural healthcare system, we did so with the thought of preserving the healthcare services within the context of that community. We have been able to do that with an addition of over 20 healthcare providers in that community, including OB surgical services, cardiology services, expanded specialty services, and the community in turn has expressed its gratitude through its hospital auxiliary by providing a $50,000 scholarship for a UTMB student each year at the presidential scholarship level. The county is also currently considering the development of a medical care center at the corner of Highway 288 and I-35 that would house UTMB operations for an urgent care facility, a medical office building, and various other expansions of healthcare services adjacent to those facilities. I think this is a huge opportunity for both the citizens of Brazoria County as well as UTMB in a partnership to improve healthcare services in that rapidly growing area of Texas. Looking a little further up I-45 from the UTMB perspective, we also see a increasing campus at our League City facility that includes a very large collaboration with UTMD Anderson, expansion of services there in our hospital and in our urgent care facility that accompanies the hospital. We are adding on several new floors to provide additional hospital beds for a growing number of admissions to that site, and relocating some services over to our Clear Lake Hospital. And by the way, that's the fourth area of expansion I want to mention today and did cover in our talk with our employees and personnel. The Clear Lake Hospital facility has exceeded all of our expectations in both the support from the community, the support from community physicians, and the support from patients. In short, the admissions and discharges from that facility have exceeded all of our financial projections. We are completing a renovation of the four-story office building adjacent to the hospital. We already have cardiology and other advanced internal medicine specialty services there. We are adding additional GI, cardiovascular surgery facilities, and we're also adding orthopedic services there. We will have an entire line of women's health care services, everything from women's wellness care and dermatology services to other health and cardiology services designed especially for women. We also have the usual pediatric and family medicine services in abundance in that particular area, with more being added on a daily basis. We are very proud of the growth in our hospitals and our clinics in that area. They continue to be leading in the community to offer services for all types of appointments in primary care and specialty service areas. We do not forget about a fifth part of our health system, and that is the Correctional Managed Healthcare Organization. Correctional healthcare has grown remarkably due to the aging offender base that it serves and those individuals who have chronic medical diseases. And of course the usual surgical problems that accompany aging, particularly related to cancer and disabilities associated with chronic disease such as diabetes and stroke. We have an abundance of those services being provided in the Hospital Galveston facility, which was built in 1983. That facility is owned and now operated by UTMB, having been gifted to the university by the legislature. Unfortunately, the legislature did not provide additional funding for renovation of that facility, and as many would say, its days of usefulness are numbered. With that in mind, we have gone to the market for some consulting services to get the best advice on how to utilize the beds that we have in that facility and how we can provide healthcare services to the correctional population in a more efficient and cost-effective manner, while at the same time maintaining all of the necessary standards for services to the incarcerated. More on that in our next town hall, in that we hope there will be some reports available on that for you. Meanwhile, we are working closely with TDCJ for the build out of additional infirmary beds and replacement beds to add additional space for people as they move away from Hospital Galveston and still need nursing home kind of services in the correctional facility. We did some shout outs today to some of our outstanding employees, particularly those in the revenue cycle area who did special duty and extra time coming to work during the recent Hurricane Imelda. In spite of rising waters, many of these individuals came on into work and worked overtime shifts in order to cover their colleagues who were homebound because of rising water. We have a remarkable team of employees here at UTMB that include our frontline staff, our faculty, and our nursing staffs and therapists who work in our outpatient and inpatient areas. We expressed our gratitude to our employees at today's meeting by reminding them that the merit increases will occur later in this calendar year as usual, and also the incentive payments, our team awards as we call them, will be done in November of this year. That will be for those eligible employees, a $500 team award in the month of November. So check with your supervisor to see if you qualify for that award. It depends on your longevity here at UTMB and your employment record. It's my thanks to you for doing a great job in making UTMB in that top 10 in the nation and making UTMB the top 1 in this county of places to go for health care that is highly, highly valued by its customers. Thank you for tuning in today.
UTMB Health, working together to work wonders.